Good morning. Thanks for being here this morning. Joined this morning by Indiana Attorney General Greg Zeller and Assistant Agent in Charge of the Indianapolis DEA Office, Greg Westfall. As we've discussed in the past, and as we're all aware, addiction to prescription medication continues to be a plague upon our state and our nation. It is thus particularly distressing when medical professionals facilitate the distribution of those drugs for abuse. As you are aware, as of yesterday, we have charged and arrested Dr. Tristan Stonger. Dr. Stonger is charged with 2 counts of distribution of hydrocodone, which is a level 2 felony. He is charged with 1 count distribution of morphine as a level 5 felony, 2 counts distribution of amphetamines as a level 6 felony, and 1 count distribution of a legend drug, also a level 6 felony. As set forth in the probable cause affidavit, these were distributed to a patient without any legitimate medical purpose, and were done so while engaging in a sexual relationship with that patient. These charges are as a result of investigation involving numerous agencies, including the Indiana Attorney General's Office, the DEA, task force officers from Indianapolis Metropolitan Police Department, as well as the participation of our deputy prosecutors, Rick Frank, Tim Delaney, and John Bober. With that, Mr. Westphal.
Thank you. Good morning. First, I'd like to thank all the prosecutors, investigators, and support staff that assisted us with this investigation and continue to assist as this investigation continues. This investigation, as well as many of our other investigations, is a result of a collaborative or team approach. The message I'd like to say today is clear. If you're addicted to drugs, help us reduce demand and seek help. If you're an individual or an organization who exploit the weakness of addiction, which contributes to the violence in our communities, the overdose deaths, and the destruction of families, the DEA Indianapolis and our other federal, state, and local partners will identify, investigate, and bring you to justice. Through our investigative efforts, we will contribute to reducing violence in our communities, save lives by reducing the number of overdose deaths, and possibly repair some broken families which were broken apart as a result of drug addiction. If you need help or resources, there are various websites and organizations to assist. The DEA.gov website is a great resource that you can use to access and see prevention places. There's information on prevention. We also, there's tip lines available on that website. You can do it anonymously. And you're more than welcome to call our main number at the DEA Indianapolis office if you have more information regarding this case or anything that you would like us to look at, which is 317-226-7977. In closing, when it comes to drug abuse and drug addiction, just say no still works.
Well, first let me thank Prosecutor Curry and his team here at the Marion County Prosecutor's Office, our state and federal partners. I want to, the collaboration that we do every day is not usually something that you see, but here's a great example of the partnership that's developed between all levels of government in focusing on really this huge man-made problem of prescription drugs in our state and our nation. Special thanks to Jessica Krug, who's a deputy in my office, that's worked on this team. I think what this case really exemplifies is the fact that the problems associated with prescription drugs can often leave the people very vulnerable, and too often they can become the victims themselves. It shows how addiction to prescription drug really have caused all sorts of problems that aren't readily visible at first blush. So with the efforts that we've taken to reduce overprescribing, we're going to see more of these types of problems in my office, and with the help of the Prescription Drug Task Force that I'm involved with, we've really helped reduce the amount of overprescribing. We've shut down 9 pill mills. There's now a new law and a new prescribing rule that helps doctors recognize when and where it's appropriate. So we've really reduced the access to overprescribed prescription drugs. But the problem that we're going to see with the, let's say, the cutback in the supply side is that there's still a demand, and it leaves the people who are addicted very vulnerable. So this is yet another example of where you can almost imagine the vulnerability of people who are addicted to prescription drugs. We'll see a spike in heroin use and overdoses as a natural consequence of this reduction in prescription drugs. So again, my thanks to our partners, not only in this case, but also in the teamwork in dealing with the overprescribers and some of the problems that are man-made with this prescription drug abuse. Finally, there will be a hearing before the Medical Licensing Board on Thursday. We'll kind of hold comments on that until Thursday, but there will be really a focus on the license of this individual before the Medical Licensing Board on Thursday. So with that, take any questions.
Any questions?
Sure. This might be for Attorney General Zeller. You touched on it at the end there, but Dr. Stonger is also being investigated. His offices were raided in February on allegations of overprescribing. With him out of the mix, now you're going to have a lot of dope sick people, people who were dependent on Dr. Stonger for their meds.
Yeah.
What advice, what can they do in this?
Well, we've seen this in a number of cases where we've had emergency suspensions of licenses. Just up in Fort Wayne, we did this a week ago. There were over 1,700 patients. The first effort will be to try to get the patient records. In order to see another physician, you're going to need those records. So step one will be to try to make sure that, as the law requires, that the physician has to make copies of these records so that another physician can take over. The other thing is, I'll kind of repeat our friends at the DEA, this is an opportunity to get help. The recognition that without these pain meds, it's not so much treating a pain, but of an addiction pain. So when you see people turn to heroin, it's not because they're seeking to get high. A lot of times they're trying to avoid the pain of withdrawal. So this is an opportunity for the patients to not only get their records and to seek new medical help, but also to seek help with their prescription drug problems, either addiction or a tolerance that's now gotten to the point of addiction. So those are the steps that are going to be necessary, but we'll really focus on bringing the medical community in to kind of support these patients of the doctor.
You mentioned 9 pill mills that have been shut down. Can you kind of describe what those operations were?
Well, we don't really see this as much, but we had a number of them early on where you weren't even required to be a licensed physician to own a pain clinic. So it was essentially pills for cash, and they would get physicians to write scripts, and it was literally just one after another after another. So the worst cases of overprescribing came from what we call pill mills. And the telltale sign, we may still have a few that we're looking at, but there'll be people parked, you know, up and down the street waiting for the clinic to open, license plates from all over the country, and it's always cash. So again, we've really cut back on that. If there are others, hopefully they won't be around for long. But a pill mill is literally cash for pills, and it's the telltale signs of people coming from all over to access easily available prescription drugs.
Do these charges have to do with just the one victim? Another question, do you expect more victims to come forth and more charges as a result of that?
To answer the first part, yes, these charges relate to one specific patient. And otherwise, there are matters of ongoing investigation, not only in Marion County, but the other 2 counties as well.
Is the allegation that this was a quid pro quo of the sexual relationship for pills, or is it just the 2 of those things were happening simultaneously?
As set forth in the probable cause, at least on some occasions, the patient was not charged for a visit as such. But no, the fundamental allegation is that there was no legitimate medical purpose for these prescriptions.
In other words, whether the 2 are connected or not is sort of irrelevant, it's still.
Ultimately irrelevant, yes. That's correct.
Do you expect more patients to come forth and more charges to be brought?
Well, certainly, as Special Agent Westfall indicated, we do encourage anyone who has information related to this case or similar situations to notify the DEA at the number that we have provided.
Does this case highlight the depth people will go to for prescription drugs? And you highlighted the abuse and the issues that we have in our state. Can you touch on the depth?
Well, you know, just not necessarily this case, but the vulnerability of people who are addicted to these opioids, so the narcotics, the prescription drugs. We see it very often in some of the problems associated with human trafficking, so-called prostitution. A lot of them are addicted, and it's a controlling element, so it's the ability to get people to do things they would otherwise not do. And quite frankly, it may be an escape. So people who've been abused, run away, get caught up in human trafficking, they'll often seek drugs as let's say, an escape from the horror that their life has become.
But we're also talking about a doctor whose job it is to uphold standards, who took an oath. Not
Yeah. Well, and again, we've seen other cases of overprescribing. It's usually, you know, due to financial gain. But here, I think playing, you know, the charges that are brought kind of demonstrate the vulnerability of a patient, and particularly if they're addicted. And again, I'm making that assumption. It's not a statement of fact.